media platform at Primus Media City. Let's go. You're connected into the sound you crave.
An all-time favorite.
Primus Radio, bringing you the hottest hits non-stop. Primus Radio is the sound of Ibadan,
Ladies and gentlemen,
where good times and great music collide.
here it is, the most listened to radio show on the planet. Even the other stations are tuned in too.
Are you ready to explore the world around you with fresh insights? Tune in to Mindful Matters. Join us every week as we dive deep into topics that matters. Our experts, guests, and thought-provoking discussions will enlighten, educate, and inspire positive change. Catch us every Thursday by 4 to 5 p.m. on Primus Media City. Mindful Matters, bringing reality to you.
Mindful Matters.
Hey, Mr. Israel, I forgot one say.
Israel. Wọ́n gbé wa. Dáìdí àkànwá. A lè ṣe o.
That one said. Mr. Kenny, I forgot one said.
Mr. Kenny, Chaleku, iṣẹ́ wà bóyá kíá lọ́kọ̀jẹ́.
System that one said.
Mommy Dara, ẹ̀kújọ mẹ́ta. I forgot one said.
Ẹ fi sílẹ̀ ó ń dín wọ́n.
That one said.
Pressy, stop.
That one said.
Bolo gentle,
Happy birthday to you, sir!
Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday.
Good evening, everyone at home. How are you doing? That is the video of the founder of Primus Media City. He did his birthday this week, and to honor him, we decided to play his video to Mr. Afonda Samuel. On behalf of Mindful Matter, we're saying happy birthday and we're wishing you the best of the best. When you see a good man, it will definitely create a talent that will invite a lot of destiny. So once again, we are saying happy birthday. Now to say thank you to all Primus Media team people. We really say thank you for working with us. Thank you for being with us on this platform, Mindful Matter. From the producer, Mr. Israel Babalola, to the studio manager, Mr. Kenny, and every other staff. We say thank you very, very much. You guys are wonderful and you are very, very accommodating. Thank you so much. Now goes to the quote of the day. The house you stay while you were growing up is still there. The school you attend while you were growing up, they are still there. The neighborhood you love most are still there. But the people that you met during those times, they are not there anymore. So I will say to you, the past has nothing to offer. Move on, seek the future, for the future is bright. Good evening, everyone at home. It's another cool Thursday here. We thank God Almighty for the season Welcome to Mindful Matter. Mindful Matter is a radio talk show where we discuss important sectors around our society. We believe we have a role to play. You can listen to Mindful Matter on Primus Media City, via Radio Garden, Zeno Radio, Radio Net, and Radio Box. My name is Oluwole Abayomi Williams, also known as the Dove. It is good to have you join us today on the show. This Mindful Matter is here to educate, to enlighten, and to teach us on what to do in our surroundings. Before I move on, I would like to introduce my analysts in the house. Some of you might have known them, but for the person watching us for the first time, I have my two analysts here, which are Omolola Opasina, also known as strictly Sapphire, and Tony Onyemah, also known as Onyx. So let me allow Omolola Opasina to greet everyone at home and greet our viewers too. To you, Omolola.
Good afternoon, everybody. It's another beautiful Thursday, and we are so glad to be here bringing you realities. Welcome to Mindful Matters.
All right. Thank you very much, Omolola, for that. Now to Tony Onyemah. Please greet the people at home.
A very good afternoon to our dear listeners, wherever you might be. Once again, it's Thursday, and it is Mindful Matters o'clock. Regardless of what the situation of the country might be, we hope you are there to gain more on yet another topic on Mindful Matters. Please do continue staying with us to the end of the program.
All right. Thank you very much for that, Tony. To the people at home, Mindful Matter, like I said earlier, is a radio and TV talk show, and today we are bringing another sensitive topic titled Abortion and Pro-Abortion. Yes, I know for people who don't understand this, our analyst in the house would dig into this topic and make it clear to us. So on behalf of Mindful Matter, we'll remember some of these things we said, that people that share most of our programs will gift them. We are watching, so we'll contact the necessary people. So you guys have nothing to worry about. We didn't forget you at all. And for people, their birthdays are October, so you can still bring in your birthday wish. There's no problem about that. Before we move on to today's topic, we would like to go on a musical break, a very short one. So when we are back, then we'll continue the conversation. From my end, welcome to Mindful Matters.
Mindful Matters, Mindful Matters, Mindful Matters, Mindful Matters.
All right, welcome back. Like I said earlier, today's topic is abortion, pro-abortion. So today we're going to dig into it. And the viewers out there, you watching us, you will understand everything. So back to my analyst in the house, Omolola and Tony. We are here today again with another sensitive topic, abortion and pro-abortion. So let me move to Omolola first. Omolola, what's your own take? What do you see? What's the meaning of abortion and pro-abortion to you?
Abortion is, I believe abortion is, I believe, abortion is the deliberate step taken to end the life of a fetus at an early stage before it gets to the birth of a child. It could also mean the removal. It's a deliberate step taken to remove a fetus or an embryo from the womb of the mother at an early stage before it becomes a baby, or rather before the woman gives birth to a baby. Now, while pro-abortion, there are two different terms. Pro-abortion is a particular stance taken by, it could be an individual or a group of people that supports the legalization of abortion, or they support women having access to abortion.
All right. Thank you very much, Omolola. Back to Onyx. What is your own take? What do you understand by abortion and pro-abortion, please?
Okay. Abortion. This is another mindful matter again. Yeah, abortion, I would say, is one of the most controversial issues of recent times all over the world. And simply put, as my colleague has emphasized on it, it is the termination of a pregnancy, the intentional ending of a pregnancy. When a woman intentionally decides to kill the embryo or the fetus, the premature human in her body, that is what we refer to be abortion. And I guess it is of two kinds, so that we won't be mixing things up. We have that of the induced abortion, which is that of the voluntary removal of that premature human by that woman from her body, and the spontaneous abortion, which is often caused by accidental trauma or disease, which we often know as miscarriage. Okay, and I guess the major cause of this abortion is unwanted pregnancy. So we need to clarify that.
All right, thank you. Even though you didn't tell us pro-abortion.
Okay, so sorry about that. Pro-abortion, I see it to be an advocacy, a belief system held by some group that women should have the right to have abortion when they need it or when they want it. A kind of an advocacy, a belief system. Yes.
All right, thank you very much, Tony. Now to our viewers out there. Why we bring this topic today is simply because we understand that our society is requiring some change, and some factors are really, really calling for it. So that's why we are bringing this abortion and pro-abortion to you, our viewers, today. Now, to clarify this again, we have a short video that would bring more clarity into this abortion and pro-abortion. So as you join us in watching this short video, I believe you will understand more about the topic today. So I will say, welcome to Mindful Matters.
Most things in life aren't simple, and that includes abortion. It's personal. It can be complicated. And for many people, it's not a black and white issue. So why do people try to label it like it is? Pro-choice? Pro-life? The truth is, these labels limit the conversation and simply don't reflect how people actually feel about abortion. A majority of Americans believe abortion should remain safe and legal. Many just don't use the words pro-choice. They don't necessarily identify as pro-life either. Truth is, they just don't want to be labeled. What they want is for a woman to have access to safe and legal abortion if and when she needs it. But when it comes to abortion, who decides? Her congressman? Her governor? Her president? Women don't turn to politicians for advice about mammograms, prenatal care, or cancer treatments, and they shouldn't. Politicians don't belong in a woman's personal medical decisions about her pregnancy. When it comes down to it, we just don't know a woman's specific situation. We're not in her shoes. Ultimately, decisions about whether to choose adoption, end a pregnancy, or raise a child must be left to a woman, her family, and her faith, with the counsel of her doctor or healthcare provider. So the next time you talk about abortion, don't let the labels box you in. Have a different conversation. A conversation that doesn't divide you, but is based on mutual respect and empathy. To learn more, go to notinhershoes.org.
We understand something in our society today, that abortion and pro-abortion is becoming something that wants to gain ground in our society. Although if we look at the situation, there are some situations that requires it and there are some situations that don't require it. But today we're digging into that. So back to my analyst in the house. Now, here comes my question. Is this abortion and pro-abortion, is he a human thing to do? Is he human rights? Does he have a kind of legal right to us? Is he a human thing to do in our society? Let me start from Tony. Tony, what's your take on this? Is this abortion a normal thing for us to do?
Okay, I guess the video you played now tells it all. And like I said, it is a controversial issue, which we really don't need to beat about the bush. To me, I think it is both a human rights issue and a matter of health as well. Because by what you heard from the video, we have two advocacy in that regard: the pro-choice and the pro-life.
Yeah.
By the time you go, understanding their stance on abortion, you won't want to weigh in on one over the other. The pro-life, they are of this advocacy, and they coined that advocacy from the fundamental human right of right to life. And they believe that for a woman who has that embryo, that growing human in her, they believe that fetus is meant to enjoy that same right that a person has. They believe that the embryo of the fetus is a growing person, and a person is born with right to life. So the fetus also needed to enjoy that right to life. Therefore, we should preserve that life of that embryo or that fetus. So that is their own kind of stand. But that of the pro-choice is talking about the fundamental human right to privacy, the freedom of choice. Okay. They coined it on the fact that it is their own body. They needed to make, their own decision. They believe no one is totally free, except if the person decides what he or she wants with her body, with her own reproductive anatomy. Okay. So it is a matter of human right. And when you talk about matter of health, like you heard from that video, what about if that pregnancy will cause the life of that woman? I guess health practitioners, the health workers will want to agree with me that they will support the woman or even advise the woman to abort the baby if it's to cost her life. So we don't really know what that woman is passing through in that regard. It is only that woman that will decide if she wants to keep the baby or she wants to let the baby go. Because even if it is not medically proven that maybe the woman is facing anything, what about the psychological aspect of it that the woman is passing through? Maybe she doesn't want to keep the baby. So I don't really want to support maybe it is a human rights issue or that of the healthcare. I think they are both.
Okay, thank you very much, Onyx. I really appreciate it. Now to Omolola, our mom in the house. So what's your take in this? Is it a human rights issue, and is it healthcare? Is it legitimately healthcare to us?
I would also say it weighs on the two sides. Both
Okay.
human, as long as there's right to life, there's right to freedom, there's right to indiscrimination, there's right to health as well. A woman also has a right to decide whether she wants to keep a child or not. Denying a woman access to legally to abortion is saying that so far this is how far you can be treated, because abortion, whether we like it or not, is categorized under health. So now it's like saying, so far this is how far we can treat you. When it comes to abortion, you can't go that way, you can't go that route. So you see, in as much as the fetus is growing in the woman's body, the fetus is not growing independently of that woman. So you see, the pro-life, the pro-choice, they're like, oh, the fetus has a right to life, but can the fetus survive outside the woman's body? No, it can't for now. So if it's going to endanger the woman's life, that's number one. And number two, if the woman is not mentally ready, financially ready, psychologically ready to raise or to give birth to that baby, then the woman has the right to end the fetus life, for a better future, a better tomorrow.
Okay, thank you very much, Omolola. To our viewers out there, to make this issue more clearer, I've been hearing abortion, pro-abortion, abortion, pro-abortion. I think it's time to, understand what abortion really means. There's a video that really shows us exactly how abortion is being done. So for us to be able to know, maybe it is health-wise, it is human right, and stuff like that. So in some seconds now, a video will be popping up showing us on how abortion is being done, like these three types of abortion that we have. So let's go to the studio and let the video from Dr. Anthony please be played. Thank you.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I performed over 1,200 abortions. First, I'm going to describe a first trimester medical abortion. This is a procedure in which the mother swallows pills in order to terminate her baby, and it is performed up to the 9th week of pregnancy. The procedure involves 2 steps. Step 1. At the abortion clinic or doctor's office, the woman takes pills which contain mifepristone, also called RU46. RU46 blocks the action of a hormone called progesterone. Progesterone is naturally produced in the mother's body to stabilize the lining of the uterus. When RU46 blocks progesterone, the lining of the mother's uterus breaks down, cutting off blood and nourishment to the baby, who then dies inside the mother's womb. It is important to note that even after it has been taken, it is possible to reverse the effects of RU46 and save the baby if progesterone is administered. The sooner, the better. Step 2. 24 to 48 hours after taking RU46, the woman takes misoprostol, also called Cytotec, that is administered either orally or vaginally. RU46 and misoprostol together cause severe cramping, contractions, and often heavy bleeding to force the dead baby out of the woman's uterus. The process can be very intense and painful, and the bleeding and contractions can last from a few hours to several days. While she could lose her baby anytime and anywhere during this process, the woman will often sit on a toilet as she prepares to expel the child, which she will then flush. She may even see her dead baby within the pregnancy sac. At 9 weeks, for example, the baby will be almost an inch long, and if she looks carefully, she might be able to count the fingers and toes. After she has disposed of her baby, the woman may have bleeding and spotting for several weeks. Bleeding lasts, on average, 9 to 16 days. 8% of women bleed more than 30 days, and 1% require hospitalization because of heavy bleeding. RU46 is only FDA approved for the first 7 weeks of pregnancy. While RU46 can be used off-label up to 9 weeks, the failure rate increases as the pregnancy progresses. At 7 weeks, it has a 5% failure rate. At 8 weeks, an 8% failure rate, and at 9 weeks, a 10% failure rate. If failure occurs, she will usually be offered a surgical abortion. For the mother, medical abortion often causes abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy. First trimester surgical abortion called suction D&C, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta. Though the uterus is mostly emptied at this point, one of the risks of a suction D&C is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape a lining of the uterus. A curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and in rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. Second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and a 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. Finally, I'm going to describe a 3rd trimester induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levitino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions.
Welcome back. I believe our viewers out there now understand what abortion, how it's done. You all now understand how it is. Mindful Matter is a radio and TV talk show that educates, enlightens, and gives us more insights about everything happening in our society, because we believe we have a role to play. So I say, welcome to Mindful Matters. Now, back to the conversation of the day. After watching this video, this question is now coming up in my mind. I would like to ask my analyst in the house. With this video we've all watched, how can abortion and pro-abortion, how can it affect our society? What are the disadvantages? Because this video on itself, it's so somehow. So let me move to Omolola as the lady in the house. Now, how can this abortion and pro-abortion, how can it affect our society in Nigeria today?
I believe whether the government likes it or not, women will find a way to discard unwanted pregnancies. So you see, the way abortion affects our society is that when women don't have access to good safe abortion, yes, that's the word, safe abortion. If women don't have access to safe abortion, there will be rise and increase in unsafe abortion, which will increase maternal death. Nigeria has one of the highest maternal death rates in the world right now.
Wow.
Yes. So, and which I believe unsafe abortion could be one of the major causes. So you see, women go through the other routes because they know that I can be criminalized for this. So they go do the back end or the backdoor abortion, which can lead to higher health complications, which can lead to higher financial burdens, because health complication, you won't be looking at yourself, or rather your wife or your girlfriend or whoever, your partner, even the woman herself, you would pay more to get yourself to feel better, to get better. Now, secondly, let's talk about mothers that have children already and they're not ready for another one, or they don't want another baby yet, or they are done with childbearing. Now they go abort and they lose their life. What happens to the children that they are leaving behind? So that's one of the effects of abortion in our society. We have high maternity death rate. We have increase in financial burdens on both the woman, the society, the family members. We have high how am I going to put this now? The children that are left behind by dead mothers. You see, what will happen? What was their fate now? They are being thrown back into the society, and we are breeding children that are not healthy, because there's something that a maternal care does for a child. So if that is not available, then it bounces back on society. There are a whole lot of effects, but let me just stop at that.
All right, thank you very much, Omolola. Now to Tony. What are the side effects of this abortion and this pro-abortion of a thing? What are the side effects on our society today?
Thank you very much for that, and I really appreciate you directing the question to her first, because it concerns ladies and women in the society.
Okay.
Although the effect of abortion, directly affects the mother and the unborn child, it is still an undeniable fact that it greatly affects the overall community and the society of that woman who intentionally, deliberately decided to terminate a pregnancy. In this side of the world, we see abortion affecting greatly the society morally, socially, psychologically, and even financially, as she has claimed. When you talk about the psychological consequences of abortion, you see this particular menace that we are discussing about, this issue we are discussing now, may actually contribute to the increasing rate of suicide in the society. Imagine a woman who, best known to her, knows the reason why she aborted a baby that the whole public or the whole community knows of. And because of that, they start stigmatizing her. They start calling her names. A promiscuous woman, this and this and that. Do you know that could lead to her committing suicide? What about that on part of a man? If abortion has been legalized in that regard, promiscuity will increase in that regard. And that woman, that man, you're already telling him that, forget about consequences of childbearing in that regard. That man will just, psychologically it will be affecting the mental state, the mental health of that man. When you talk about the moral aspect of it, the moral consequences of it, for goodness sake, it will surely affect the sexual activity in the society, in the community. You are more like you are legislating abortion. Don't forget, such legislation could actually mean removal of the consequences of childbearing, and you are now increasing the rate of promiscuity among married women. You are directly, in this regard, giving the certificate, supporting the culture of death, the certificate for women to intentionally, kill. That abnormality, that mentality in that regard. So morally, the society is going to plunge the more, decay the more. And when you talk about the social aspect of it, I think I mixed it up with that of the psychological aspect. The woman, the stigma that will follow the woman in the society. Oh, they label her. Oh, this one, she's an abortionist. Oh, we see her with pregnancy 2 weeks ago or last week. We can't see it again. She has gone to abort. Maybe they see her with different men. They start calling her names. What about the trauma that will set in on her? If maybe it is that spontaneous type of abortion that is being caused by, all these accidental trauma and stuff like that. What about the in-law? What will they start calling her? She's a witch. Oh, a baby cannot stay in her womb every year. Miscarriage, every year miscarriage. Mental health, affecting mental health. So there are a lot of things that this abortion could actually, do to our society in a negative way.
All right, thank you very much, Tony. For the callers, we are seeing your calls. Please, you can call in now. It is time to pick calls if you want to call. And if you want to join us on the comment section, please do that. Mindful Matter is a radio and TV talk show that brings reality to you all. Now, like our usual culture, we went outside to ask this question, to know the opinion of people out there and to see their own view towards this abortion and pro-abortion of a thing. So we got some few results. So in some few seconds now, the vox pop should be played. Welcome to Mindful Matters.
Mindful Matters, Mindful Matters. Mindful Matters, Mindful Matters.
So the government can't legalize abortion because really legalizing abortion is just like deprive the baby the right to life, and having the right to life is one of the fundamental rights a citizen can enjoy, and even mind you, selling that legalizing abortion is so unlogical, it's going so unethical. So the two situations are just distance apart. There are two parallel lines that can't meet. So the government definitely can't and shouldn't legalize abortion. Thank you.
It's not okay. Ọlọ́run ọ̀fẹ́.
Is one of the fundamental rights a citizen can enjoy.
Hello.
And even mind you, selling.
Yeah. Good evening.
Yeah. Good evening. Welcome on the show.
Yeah. This is Amy calling.
Oh. Nice having you on the show.
Yeah. Thank you. I'm very happy to. I've been watching the program today, and I'm very, very impressed.
Okay.
I'm very impressed. Is this abortion of a thing is a very big issue or challenge in our society today. Hello, are you there?
I'm here. I'm listening to you.
So the abortion is a very big issue. Well, let me just put it that way because it's number one thing that I personally hate because the person or the baby you want to flush, you don't know the support, you don't know what the person is going to be tomorrow. You just decided to do what to flush the baby out just like that because of you don't want the baby or unwanted pregnancy.
Okay. Can I ask you a question? What if the lady was raped or something happened within the family and it's improper to the society? Don't you think abortion should be the next thing for them to do? Or what do you see?
Abortion is not the necessary. If the marriage or the friendship is not what they want or it doesn't work out, I believe the mother or the girl can be able to have the baby, train the baby. The baby can become something tomorrow. it's not possible for you to do what to abort a baby because you don't want it. See, to me, okay. I don't like that.
all right. Thank you for your.
To me, I don't like that. So I can advise everyone out there: abortion is not the necessary thing to do.
All right.
I believe.
All right.
Let the baby. Can I tell you something that's very similar to this? If you don't mind.
Oh no. You know what? Our time is we don't give much time to callers like that. I'm sorry, please. But your I would like please your own explanation is well noted. Don't worry. Thank you very much for calling in. Thank you. And you're our first caller anyway. So after the show, we're going to send you a recharge card. Okay.
Can we get your name, please?
Wow! I can't wait. Wow, that's good.
Can we get your name, please?
Thank you. My name is Emmanuel.
Okay. Mr. Emmanuel.
All right.
My name is Emmanuel.
We'll get back to you.
Thank you.
Thank you very much.
All right. Thank you.
That's Mr. Emmanuel on the phone. Yeah. We all have a different opinion towards this issue. So that's Mr. Emmanuel's opinion. Now, back to the conversation at hand. Now, to my analyst in the house, the next question here on my board is this. The other lady we interviewed outside was saying something about legalize or not legalizing. So now to my analyst in the house, should abortion, should it be legalized in this country, in our society, in Nigeria? Let me start from Omolola. So Omolola, what's your take on this? Do you think abortion should be legalized in Nigeria?
See, the controversy as to whether abortion should be legalized in Nigeria has been a long one, and it's also kind of complex. It's complicated because you have to consider the moral aspect, the religious aspect, a cultural aspect. Nigeria is big on culture and religion, so you see, I can't say, abortion should be legalized or abortion shouldn't be legalized. But in Western world, the Western Europe most especially, where abortion is generally permitted, we have about 12 of every 1,000 women are coming for the abortion. Whereas in other countries, Africa, where abortion is not legalized, we see more than 40 women out of 1,000 go in for abortion. So can you see the difference now? A country which legalized abortion has put measures in place. There's the pre-abortion counseling, there's the proper abortion care, there's the post-abortion counseling. You see, so women that come in, it's not just a one-time thing, like they do it and then they go. No, there are several stages. Whereas a country where there's restriction has not reduced the abortion rate. It has not. So, but if government should legalize abortion in Nigeria, it's going to reduce maternal death rates significantly. It's going to reduce it significantly. Yes, women will have access to safe abortion. They would be properly counseled. In fact, what some women need, is not even the abortion itself. They just need acceptance. They just need love. So you see, during the counseling section, they can open up to what exactly the problem is, and some of them will go through with the pregnancy, and some will say, okay, you know what, let me give up my baby to couples that are actually looking for children. So you see, it's not we don't have a one size fits all for legalizing abortion. I'm sure that in Nigeria we are scared of if we legalize abortion, won't we abuse it just like we do in our country? We abuse almost everything. But then we have to weigh the two sides.
Okay, thank you very much, Omolola. Now back to Tony. I believe you listened to the voice pop that we played of recent.
Yes.
The lady was saying abortion should not be legalized. Now, do you think abortion should be legalized or not in Nigeria? What's your take on this, please?
Let me put it straight, point blank, that abortion should not be legalized. Why do I say that? Simply because of its implications, simply because of its consequences, its moral implication, its social implication, its psychological effect? What about its financial effect on that of the man and on that of the society? Legalizing abortion is like you giving room for promiscuity on the rise. You having a hand-in-hand agreement with promiscuity among even married women. Married women, once they have that little quarrel with their husband and they are pregnant, they may easily not legalize here. They will just quickly go and terminate the pregnancy, affecting the psychology of the man, and not forgetting about the implication of their own health too. So no and no. No to legalization of abortion. Yeah, there may be some, lenient measures put in place to accommodate all those kind of pregnancies that may actually take the life of that woman, where abortion could, with a bit of leniency, be granted to those women for the preservation of their lives. But no to legalization of abortion.
All right, thank you very much, Tony, for your own view. I really appreciate that. Now, with Omolola was saying something the other time, and that has come up to me as a question now. Omolola was saying something like Nigeria is a very religious country, and which, if we are to make proper research about that, it's true. So now, what do you guys think about the religious aspect in this abortion and pro-abortion? Let me start from Omolola. So Omolola, what do you see to this religion aspect about abortion and pro-abortion thing in Nigeria?
Most religion does not support abortion.
Okay.
It's more of their moral compass. It's more like you are killing a life. So to them it is no. Even the from the Catholic to the Protestants to the Buddhists to the Islamic, they've all come. I think they stand on this one, that there is their stand on abortion is a no. But if you can accept, I think in Nigeria, as much as abortion is a criminal offense, there's a wide acceptance for sex. I've forgotten the term now. I think the sex determinant abortion. For example, if you don't want, let's say you have boys already, and the next baby that is coming in is a boy, you can decide, you are permitted to decide to abort that. But then, if you can permit that, then you can as well make permission for safe abortion. Safe abortion.
Yes. All right. Thank you, Omolola. Now, with this abortion of a thing in our country, I don't know. I'm going to ask you, my analyst in the house. Do we have a law that binds this abortion in our country, Nigeria? Let me go straight to Tony. Tony, do you think we have a law that's, a kind of punishable law under the Nigerian constitution, towards this abortion of a thing? Is there any law,
Okay. I think abortion is legally restricted in the country because in Nigeria, going by the constitution of the country as amended, the 1999 constitution, abortion is governed by the two major laws, and it differs on the geographical location. We have that of the northern part of the country and the southern part of the country. For the northern part of the country, we have the penal code governing abortion in that regard, and in the southern part of the country, we have that of the criminal code. But I guess there should be a bit of reform on these codes, on these laws, because that of the northern part of the country, where we have the penal code, both the abortionist, the medical practitioner, the abortion vendor, as well as the person that supplied the pills for that abortion, they have their own kind of offense and punishment stipulated in the constitution. For that of the penal code, you have it in section 232, 233, and 235 of the constitution. Okay. And for the criminal code, you have it in section 228, 229, and 230. They are both parallel, but there's this sharp difference, which I guess there should be a kind of a reform in it, because that of the northern part, the penal code gives a bit of leniency to the preservation of the life of the mother of that baby, but you can't find it in that of the criminal code. That is why I think there should be a kind of a reform to that law. Then the effectiveness of this law, how effective is this law? Because you will see it even in our own modern times, in our neighborhood, in our surroundings. We see it happen. Even these medical doctors, by the oaths they take, knowing the legal implication attached to them being a vendor of this thing, you still see them still carrying out this due to, the economy of the country is hard. It's hard. Everybody, So I think there is law guiding abortion in Nigeria. Only if we can have a bit of reform to the difference between the penal code and that of the criminal code, and to actually effect these laws.
All right, thank you very much, Tony Onyemah. Thank you very much. Now back to you, Omolola. So, is there any law that is, backing it up? Because Tony gave us some.
Yes. Those are. He actually mentioned the laws. We have the penal code for the north, and then the criminal code code for the south, the southern part of Nigeria.
That's nice.
For the person that attempts abortion and is caught, will be sentenced to 14 years imprisonment, while the person, that is the woman now, comes sentenced to 7 years. The person that supplies the drug, the equipment, whatever, can be sentenced to 3 years, if I'm not wrong. Yes, those are the supplying of drugs and instruments to procure the abortion is liable for 3 years imprisonment. So those are the criminal laws that are backing abortion in Nigeria.
All right, thank you very much, Omolola. To our viewers out there, we'll believe that today's episode has been a very interesting one, and I believe you viewers out there have, you understand what abortion and pro-abortion means. To our viewers, we are planning to check our views and to see the highest person that share our show. There's a prize for that person, so please watch us. And we'll also say thank you to our last video. It's over 700. Thank you very much. We really like you guys. It shows that we are doing something right and you guys are listening. Thank you so much. Now our time is far gone, very, very, very. So on behalf of Mindful Matters, I will say have a lovely day, and we are going to see you next week with another interesting episode. Thank you.
Are you ready to explore the world around you with fresh insights? Tune in to Mindful Matters. Join us every week as we dive deep into topics that matters. Our experts, guests, and thought-provoking discussions will enlighten, educate, and inspire positive change. Catch us every Thursday by 4 to 5 p.m. on Primus Media City. Mindful Matters, bringing reality to you.
You're connected into the sound you crave.
An all-time favorite.
Primus Radio. Bringing you the hottest hits. Non-stop.